I know this video is really hard to watch for some of you, so let's talk about pain management options for IUD insertion. And in my mind, there are three components of pain that we're trying to manage when we're trying to manage pain of an IUD insertion. The anxiety of the procedure itself, the pain when we're going through the cervix, and the cramping associated with placement of the IUD. So for the anxiety of the procedure itself, I offer all my patients a Valium or an Ativan to take about 20-30 minutes before their procedure, knowing that they do need to have a ride before and after their appointment. For the pain of the tenaculum placement and the actual insertional pain, I use a paracervical block, and we're getting more and more data that this does help with the pain of IUD insertions. This study was published 5 years ago, and it tells us that 20 cc's of buffered 1% lidocaine does significantly decrease the amount of pain with an IUD insertion in nulliparous patients. Now, it's still a lidocaine injection with a needle that has to go through the vaginal epithelium, so some patients are like, no thanks, I don't want a needle near there. But I would say the people who do get the paracervical block, although the injection itself is painful, tend to do better with the actual placement. And lastly is the uterine cramping of now having a little IUD sitting inside your uterus. This is where the ibuprofen actually comes in, because although the ibuprofen doesn't help with the actual placement pain, it does help with the cramping associated with the placement. I recommend that all my patients take 800 milligrams 2 hours before their procedure and then scheduled the time after. Now, I know my field of gynecology has not been amazing about pain management, so not every OBGYN may offer all of these options to you. My suggestion, if you're interested in something, especially like a paracervical block or the Valium ahead of time, is talking to your OBGYN about it at the appointment before the actual IUD insertion so you guys can be on the same page. And if you're not on the same page, you have time to go somewhere else.